Let's talk about the significance of understanding trauma and its importance. Before being a doctor, you are first and foremost a human being. As such, you are regarded within the community as a safe and knowledgeable individual. To begin, let's take a collective deep breath. Conversations about trauma can be emotionally challenging for many individuals, so taking deep breaths can assist in returning to a calmer, parasympathetic state. This exercise is valuable to remember in your professional practice. Close your eyes and inhale deeply through your nose, counting to 4. Hold your breath briefly at the peak, then exhale slowly. You can easily conduct this exercise with patients. We recommend doing it for at least 5 breaths. Now, what does it mean to be trauma-informed? Trauma-informed care is understanding that people have experiences in their lives that change how they respond and experience their life as a direct result of the trauma. Being trauma-informed means that when you interact with a patient, you can recognize, understand, and respond appropriately to them. Perhaps we should back up a little bit. What is trauma? Trauma is the psychological, emotional response to an event or an experience that is deeply distressing or disturbing. Trauma is not the event itself, but the biological response to an event or a series of events. This explains why many people can go through the same or similar event, but have very different experiences. This is why we must avoid judging or comparing people's experiences. Examples of trauma include life-threatening illnesses, domestic abuse, bullying, sexual assault, neglect, natural disasters, accidents, or even witnessing such events, particularly during childhood. While much of the focus will be on trauma from sexual violence, remember that these teachings can be applied to all types of trauma. According to Statistics Canada, 1 in 3 women will experience sexual violence by the time they're in their early 30s. Imagine if you were a woman and sitting between 2 other women. Statistically, one of you will experience sexual assault. But it's not just females who experience sexual violence. 15% of reported cases in Canada are boys under the age of 16, even more likely perpetrated by someone they know and trust. These statistics don't include the numerous unreported cases, so the true numbers are likely significantly higher. When we consider these statistics, it's evident that a large number of your patients will have experienced sexual trauma, and even more will have faced some form of trauma in general. This is particularly crucial for doctors to recognize as they work with patients' bodies. After a sexual assault, it is common for their bodies to feel violated and unsafe, making it extremely difficult or triggering for them to undergo medical examinations by a doctor. Individuals who have experienced sexual assault often struggle with self-blame and shame. As a doctor, you might be the first person they confide in, and your response can have significant impact on their healing journey that follows that. Practicing consent during your appointments restores their sense of choice and autonomy. In your education, you are inundated with vast amounts of quantitative information from textbooks. However, understanding and implementing trauma-informed practices allows you to treat patients holistically and recognize them as individuals with diverse life experiences. Moving forward, be mindful whether you approach patients with the understanding and compassion that they may have experienced trauma. Do you acknowledge it? Do you respond appropriately?